What's going on, veterans? It's Junior Bennett coming to you live from Atlanta, Georgia. I am 100% permanent total Navy Desert Storm veteran, and today's message, I'm going to share with you some awesome news. We're constantly trying to work better for you as a veteran to get you a high value claim, which is 80 to 100%. And in that obtainment, or in that goal, or in that pursuit, we have to have top-notch, specialized doctors in the network to be able to assist you with examinations and also your medical nexus letters, correct? Okay, so we are currently based in Atlanta, Georgia. Okay, we're in Atlanta, Georgia. Most of our specialists are in Atlanta, Georgia. Okay, this is where we started, and we have some specialists in Virginia. We have specialists in Florida now. So now I want to share with you, as of today, we have a new mental health specialist that's going to be in the South Florida area. And this particular doctor is licensed for the whole state of Florida and can do virtual examinations. Yes, just like when you do a telehealth visit with your doctor at the VA, you'll be able to do a telehealth type of Zoom examination with the mental health doctor down in Florida. So if you know any veterans right now that live in Florida and you would like to refer them over for free as a New Life veteran inside the group, more than happy to do that. We'll get them access to the information as long as they can answer those 3 questions. We can do that. Or if you want to refer them as a New Life Insider to enroll into the program to have access to our doctor network that's in these states of Virginia, Florida, and of course, Atlanta, Georgia. We handle whole Georgia itself as well. So we have the doctors in place. Some of the doctors that you probably not knowing that we have, let me just go over the specialists that we do have in our doctor network. We have ENT doctors for sinusitis, rhinitis, I hope I spelled that correctly, obstructive sleep apnea, migraines. What else do we have? Okay, hearing loss for claims for tinnitus as well. All in-house in one particular specialist office, which is very unique. This doctor is an ENT surgeon. So if you suffer from any of these disabilities, we got you covered for his medical nexus letters. The next doctors we have number 2, most claim of musculoskeletal. We have orthopedics. I hope I'm spelling this correctly. Orthopedics for your musculoskeletal joint, degenerative joint disease, musculoskeletal disabilities, all right? So we have orthopedics in Virginia. We have orthopedics in Georgia, okay? We have number 3, skin doctors. If you have a skin disorder, like I do for my beard, skin disorders, we have skin doctors in Georgia. If you have an eye disability, we have doctors in Georgia. We talked about mental health again. We have mental health in Georgia, North Carolina, and Florida. Mental disorders. That's PTSD. That's anxiety disorder, depressive disorders, schizophrenia. Let me see if I missed anything. We have eye doctors. We have skin doctors. We have orthopedics. We have mental health doctors. All of these doctors are actually trained by me to be able to write those medical nexus letters. We have a relationship to help you as a veteran get that connection. I interview so many veterans doing telephone consultations, all right? And they served it back in the 80s, maybe over 4 decades. The VA is gonna knock you down every time because they're gonna say you've had jobs in between the military service and now you're claiming disabilities. The VA law says you gotta meet 3 elements of service connection. We talk about it all the time. I'm gonna go over this so you can get it in your head that all of you that are talking to VSOs, VFWs, DAVs, attorneys, what have you, They're out there, but the numbers speak for itself. They're not effective. 8 out of 10 veterans, 8 out of 10, 8, come on, right, Juniors. 8 out of 10 veterans are lowballed. 70% or lower. These are statistics. If the VFW worked, if the VSOs worked at the hospitals, if the attorneys worked, if all these people that's out here that's giving misinformation worked, we would not have these numbers. Because if they knew the Title 38 Part 4 like I do and talk about it and study it every single day, you would not have these type of numbers. And the new recipients for June 2020 or 2021 are getting about $1,100, $1,150 a month. That's less than 60%. All connections, less than 60%. If the VFWs and the VSOs and attorneys and all these accredited people who say they're quote unquote veterans advocate, if it worked, why are we getting these numbers? Okay, my company would not exist if we didn't have that. So let's talk about these 3 service connections. You got to have a current diagnosis again within the last 12 months. New diagnosis. We know that. Last 12 months. All right. Number 2, you got to have evidence. You got your service treatment records. You got that, check. You can send in your claim right now. As long as you got evidence of diagnosis, they will say, yep, we see the evidence, we see the diagnosis. But guess what? It's not connected. Why? Because you're not meeting medical nexus requirement. Medical nexus requirement. That's the reason why my company exists, because we have top-notch specialists to go against every last one of those CMP exams that you're going to have to go through, okay? Now, I want you to understand something. Medical nexus has to have so many different elements inside of that medical nexus letter. Most doctors do not want to deal with seeing you, writing a prescription, and writing out a medical nexus the way the VA needs to do it. All a doctor wants to do is see you, prescribe you, and book you for the next appointment. They don't want to have to go into their administrative department and write a legal document stating that they've seen you, looked at the evidence, and being able to put medical rationale and linking it back to server with that license on the line, the telephone number for the bigwigs at VA in DC to call you and talk to the call the doctors up and say, you saw this patient on this particular day. Let me see what you have in the file. Nobody wants to do it. That's the reason why we are doing so well and helping many veterans. I hope you guys understand. You might have your diagnosis. If you don't have a diagnosis, go get you one. You said we're in the midst of COVID. Go to the emergency room and get you a current diagnosis. If you don't have your service treatment records, go get them. Download VA form SF-180. Download the form, fax it in, and put COVID-19 expedite please on the application. Medical nexus. We're going to get your medical nexus in the mail with you within 7 to 10 days of you seeing our doctors, okay? If we see a connection, if we see a link, they're going to write the medical nexus letter for you. This is going to meet medical nexus number 3. What is that going to do for you? It's going to give you a service connected instead of saying not service connected in your e-benefits. It's going to say service connected. And what else do you need inside the medical nexus? The symptoms of severity. The symptoms got to meet the ratings. Ladies and gentlemen, you can get PTSD all day long connected, but if it's at 30%, are you getting the highest value that you deserve? Probably not. You probably got higher symptoms, but you're getting rated at PTSD at 30% when you should be at 70%, okay? These are the things that veteran servers suffer with, and I'm just trying to help you guys win the highest value claim for you and your family. If you need a free consultation, I suggest you stop what you're doing right now, go to newlifeveterans.com, schedule a free consultation right now so you can get your claim looked at individually, customized to you for you and your family. If you're married with dependents, how much money that they could be getting and they're missing out on, the opportunities of adding secondary claims or increasing claims. The time is now and the clock is ticking. If you want to be a high-value claim veteran like I am, 100% PNT, I can't guarantee you that, but we're going to shoot as high as to 100% that we can, okay? If we see it, we're going to shoot for it. Thank you so much for watching. New Life Veterans is going to change your life.